Yes, ma'am.
So, sir has already joined, I think.
Yes, ma'am. Sir is with us.
So, sir, we welcome you. Welcome on this platform. So, you can hear us?
Yes.
Good evening, sir.
Evening.
Good evening. Okay. So, I think everybody will enjoy this session because after so much, all the 5 days, all the technical talks, this might be a very stress relieving talk. Happen so.
Hopefully it will be helpful.
Yeah, everybody is looking for it. So good evening, and we welcome you to our MACAUT, that is Maulana Abul Kalam Azad University of Technology, West Bengal. So this is the last session, and the in this AICT sponsors 6-day short-term training program on emerging nanomaterials for sustainability. So today we have with us Dr. Mithun Barik, who is a doctor by profession. So let me introduce you with all our participants. Dr. Mithun Barik is an addiction psychiatrist currently working in South Community Addiction Teams of NHS Scotland. He completed medical degree from Medical College, Kolkata. He moved to Scotland 14 years ago and has been living there since then. He has a special interest in psychological interventions for people affected by substance misuse and mental health difficulties, including post-traumatic stress. He is also a board of director in IFDAS, a charity which aims to promote recovery from addiction by working in social enterprise. So with this, I request you, sir, to start your talk.
Thank you. I'll try to share my screen. Is it visible?
Yes, sir.
Right. Thank you for the kind introduction. As mentioned, I'm an addiction psychiatrist. So after finishing my medical school, I trained in psychiatry and also have a special training in addiction psychiatry. So in any situation, what we do is we look at a holistic approach. We try to understand the person as a whole. We just don't look at one aspect of a person. We try to understand why somebody is struggling with some situation. And in general, we call it biopsychosocial model. As you can see, the biological part, which you can imagine would be mostly to genetics and other physical things. The social options, starting from upbringing to what their situation is currently, and also their psychological options, which depends on their beliefs, their emotions, their resilience. If someone struggles and has a diagnosable mental health condition, in UK, we mostly use ICD-10, which is done by WHO. And the treatment depends on, again, it's a holistic model. It varies from person to person. Today, I'm mainly going to talk about stress and anxiety, and just to give you a basic overview, so that if any of you are struggling with it, or any of you are struggling with it, you can try to sort it out yourself. Understanding how stress affects us, that's the most important aspect. And then once you understand what is happening, then you can take appropriate steps to prevent it. So is stress a mental health problem? It depends. It's being under stress, it's a normal part of the life. It can help you to take some action, get motivated and produce results. But if it becomes too much, then it becomes a problem. In general, we don't diagnose stress as a psychiatric diagnosis. There are sometimes some people can have acute stress reaction, and then they develop other mental health difficulties. But in general, having a lot of stress can cause different kind of psychiatric problems, primarily anxiety and depression. So as you can see here, what happens is if there is some external stress, and what it starts affecting is first in the body, you may notice that your heart is racing more, you are having indigestion, you are having tense shoulder. It affects your feeling, it affects your behavior, it affects almost every part of your life. Why does certain things make some people more stressed, but it doesn't affect others? It depends on the perception, how you take it, and how much you are used to the stress, your own self-esteem, how your thought process works, overall, what your emotional resilience is. If you're used to some situation, initially it might be stressful. For example, an exam. An exam is stressful to most students. It depends on their preparation level, what kind of stress they're having. But after some time, and depending on the type of exam, the stress level can reduce, or teachers can help to reduce their stress. That's where the support comes from. This is a basic concept which helps to kind of see where you are at one point. Imagine, like a window. We call it window of tolerance. And for all of us, most of the time we'd like to be in the middle section where there are stress, but we are able to manage it. And in general, in our normal workplace, in normal life, there can be stress of lot of different kind of things. But most of the time, most people can manage these with their existing resource level. Sometimes what happens is that it can go onto either side of the window. So when it goes to in the upper section, in dysregulation section, what happens is that we start to feel more agitated, we may feel anxious, we may feel angry, and it starts to feel like that things are getting out of control. And then it goes in higher stress, we become totally anxious and it becomes totally out of control, and we feel very overwhelmed. On the other side, again, if it goes to bottom of the window of tolerance, what happens is that we start to feel like we are shutting down. We kind of like we are less energetic. We don't have a track of time. We have to do a lot of things, but we are not able to do things. Again, we feel like there is not enough. We are not in control of the situation. And when it goes to farther down, we become totally zoned out and we become emotionally and physically numb. So that's these red situations where other people, well, in the orange sections, other people might notice, but in the red sections, they will start to get really, really worried that something is happening. So if you think about the brain, and most of these things are which we use for our patients. So it's actually quite simpler way to explain things. So please accept my apologies. I'm not going into too much into details. It's just quite simple and straightforward ones. So in our brain, we have got three main sections, and it's the evolutionary, thinking about the evolutionary way. So we have got the reptilian brain in the bottom section. We have got the mammalian brain, and we have the cortex. And the reptilian brain is mainly for survival. The mammalian brain, it's more about feelings, it's about memory formation, it's about enjoyment. And cortex, which most the humans use the cortex a lot. It's more about like higher mental functions, which we can do. We can do different kind of things like make complex reasoning. When all these three sections are in sync, we do really well. Sometimes what happens is that due to the situation, one things take over, especially the reptilian brain starts focusing on the survival part and the cortex loses the control, and then it becomes an issue. So let's say anger. Anger is a kind of like a stress, a common stress response. Something happens somewhere and we start to feel angry, frustrated. Maybe it's traffic, maybe it's something not going as it should be, and we start feeling angry. What happens there is that when we have the anger, it starts affecting the amygdala in our brain, and then it turns on the stress response system. So amygdala then signals the hypothalamus, and hypothalamus starts releasing the corticotropin releasing hormone, which then goes to pituitary to get the ACTH, another hormone. And this hormone in turn activates the adrenal glands, and the adrenal glands, they will secrete the stress hormones, which are cortisol primarily, then adrenaline and noradrenaline. And these hormones are quite quick to affect our neurons. The cortisol makes the neurons to take too much calcium, then it can be a problem because it's, sorry, it just moved. the neurons, they fire too quickly. Too much cortisol, it can cause a loss of neuron in the prefrontal cortex and the hippocampus. And what happens in there is, if the prefrontal cortex is getting affected, then our judgment is getting affected. That's why you see people when they are so angry, they're not able, or they're really under stress, they're not able to make good decision, or they can. Sometimes we are also not able to plan for our future because we are too much focused on the current one, but it is also because our prefrontal cortex is not working well. And the hippocampus, what happens is that the brain start struggling to make new memories and then processing the new memories. So sometimes, again, when somebody is in an argument or really angry or frustrated or stressed, then they find it hard to remember what exactly happened. Now, too much cortisol in the body, that will also reduce the serotonin. And serotonin is the one which is kind of, we can call it like a happy hormone. So it can feel, it can make the anger, the physical pain, it makes it more of an issue. And in that way, what it does, it ultimately it affects the body. Initially, there will be a lot of energies, but ultimately it starts negatively impact other parts of the body. So it can affects us physically, which means that we can often have headache, migraines. There might be some vision impairment. Sometimes we can get feelings of dry mouth, increased pressure inside the head, inside the eyes. It can cause a lot of different kind of physical health problems, like increase the heart rate, increase the blood pressure, blood glucose level. It can affect the immune system. It can affect our digestive system. It can cause, as I mentioned, migraines. So overall, all this, starting from just a simple getting angry at some situation, which is not in totally our control, we started this HP axis, which release these hormones, and ultimately it results in all these physical health situations. But today we are talking about mainly the mental health. But if you are able to control the stress, the physical health also can improve. Now, this is something you will see, like those, there are on internet, it's everywhere. There are things like 10 things to do for stress, or these 5 things, if you do, your anxiety will less or your depression will get better. These things actually work, but understanding why you are doing this and how they work. That's the main aspect, and that's what I'm trying to tell you today. So once you understand, then you can find things which work for you and you can tailor it to yourself. Everyone is different. Everybody has different ways of coping with situations. Now, the main important one, the understanding, then will lead to appropriate action. And another thing is practice. Whatever you are doing to manage, we have to keep practicing, because otherwise, if you do it once or twice, it's easy to say that this is not working, and then we fall into the same kind of VCA cycle. Now, this is just kind of an anxiety psychoeducation we provide to our patients. It's kind of quite concise. Most of the time, we do it over 3 or 4 sessions, depending on the person's level of understanding. Some people are not really able to understand or comprehend, but for most people, it's quite easy to understand. One thing to first of all remember is anxiety is normal. Everyone has anxiety at certain level. Anxiety is actually good for motivation and performance. It can affect any person at any stage of their life. It doesn't matter what kind of person they are. And so remembering that you are not alone having a stressful situation and not being able to manage, it's not the case. Everybody may have to go through this at some point of their life. So sometimes talking about it is actually quite helpful. Now, the feeling of being afraid, being scared is very much a part of our life, just because we are human, or even animals have that as well. And that's why we have the survival instinct. And it's to react to an anticipated danger, which has to be kind of realistic danger. It's not going to be always just because you are crossing a road doesn't mean that you will always be anxious. But if your car is coming quite fast, then our anxiety level increases because there is an anticipated danger. And then the whole HP axis and the survival instinct, it will get activated. And sometimes I tell my patients about the example of imagining being a caveman. That helps to understand why we have the survival instinct inbuilt. Now, the most important thing is the perception of the danger. And the perception is different to different people. So if somebody is walking through a poorly lit road, they may feel anxious because they perceive danger, but someone else may not, because they know the area well. Depends on the person's gender. Sometimes male will feel less anxious, or again, the same person may feel less anxious if they are doing that every day. So all these things, all these variable factors, it depends on whether the fight or flight response is getting activated or not, and what level it is. When this gets activated, it affects mainly the three systems which gets activated. One of them is the physical system, one of them is the cognitive system, and another one is the behavioral system. So when the physical system is getting activated, what happens is that as soon as we have got some danger, perceived danger, the brain will send a signal to our nervous system. And the autonomic nervous system has got two sections. One is the sympathetic branch, and another is the parasympathetic branch. And these two sections, they control the physical changes it occurs in fight or flight situation. So the sympathetic branch, it activates the various part of the body. It makes it ready for the action. All parts of our body, they get activated, and it's because it activates the HP axis. The adrenaline, noradrenaline gets released, and then we get ready. So if we think about the caveman example, and we are going outside hunting for food, we meet an animal. So what we have to decide at that time is whether we can kill the animal and eat it, or the animal is going to kill us and eat us. So once we have made the decision, the part of the cortex and other kind of things there is not so much important. What's important is that getting the body ready for whatever decision we made, if we are running away or we are fighting. So a lot of things happens automatically, and that produces some of the physical changes or physical sensations we have. So this gives an example, like what kind of changes we might notice. So what happens is that you will hear that a lot of patients, when they're stressed or they're anxious, they feel that their heart rate is really, really high, and they're breathing quite fast. They feel like that they are getting out of breath. And why is that happening? The reason the heart rate is high, because the heart is pumping and trying to send blood to the external limbs, because we have to fight. So we need more strength in our arms and in legs. So the muscles need oxygen. The oxygen is traveled by blood, and the heart is trying to pump more blood. It also need more oxygen from the outside. So it's the breathing gets, the breathing rate changes. Because the heart is trying to send more blood, it has to have more blood available. What it does is that it draws the blood from the organs which we don't need at that time. So we don't need to digest food when we are fighting or when we are running away. So the heart will try to draw blood from our stomach. And what happens that's why we have this kind of butterfly sensation. A lot of people will have some digestive issues if they are really stressed or anxious. Dry mouth also, it's part of the mouth, is a part of the digestive system, so we do get dry mouth. Now, one of the interesting things is that because of the decision to fight or flight has been made, sometimes the brain is also thought as not a necessary organ at that time, also, although having that would be really helpful. So sometimes bloods are drawn from the brain as well. So that's why people might feel dizzy. And there are other reactions which can happen, like sweating. Sweating is to keep the body cooler. The muscle will get more strains. The whole body is ready for action. And it depends. This will happen whether there is any real danger or not. As long as our brain believes that we are in danger, this will happen. This is automatically happens. So that's why a lot of people will be in a situation like this when they have got really struggling with breathing, and they have palpitation and they have digestive issues. There are other situations, but there is no real danger. They are not going to get run over by a car, but they still believe that something is bad going to happen, and this has been activated. So if you are able to control this, then it will be easier to reduce our stress level. There are different kind of ways to control this one. So other than the physical system, we also have the behavioral system which gets activated. So what happens is that in this case, we are either feeling like we are getting aggression, we are trying to kill the animal or we are trying to run away. Sometimes in normal society, it's not possible to run away from the situation, or also not possible to just get angry or just deal with it aggression. So sometimes what we notice that sometimes you may have seen some students like they are doing a lot of different kind of behaviors, like foot tappings, like they're like sometimes tapping on the table or doing something different, but it's mainly because they're quite anxious at that time, and they're not able to manage their feelings. In the cognitive part, what happens is that it's, as I mentioned before, it's mainly about the perception that the person is in danger. So it's try to, the cognitive part at that time tries to scan the other areas, constantly looking for whether there is any danger other than the one we already see, or even if it's not there, we're looking for some potential threat. And that's why, because it's active in that one, we have difficulty in concentration in some other aspects in our work, because we are constantly thinking about other things and looking for potential threat. And sometimes there might not be an obvious threat because it's not there. It's about our perception. However, because the belief is there, it will continue scanning. And most of the time, we don't know why we are doing this. Sometimes some of the obvious threat is not there, and we feel like what's happening. Then we start thinking about us, and we start thinking about, like, there must be something wrong with me, or I'm weak, or I can't do that. So it goes into this negative kind of thought pattern, which is also not really helpful. Now, once these things happen, once the threat is gone, the body is supposed to come back to a normal situation. So the parasympathetic branch will begin the process of the opposite on the sympathetic branch. So it will instruct the body to the heart rate getting slow, breathing rate slow, the body temperature will be normal, the muscle will start to relax, and we will go back to a normal level. But it doesn't get to normal level immediately. It takes some time because there still might be some potential danger. So even if we have killed the animal or run away, there might be other animals around. So we have to have still some level of arousal so that we can react quickly. When we go back to our cave in our safe place, we don't have to do that. But if we are still outside, we still have to do that. So the residual effect are always there. The difficulty is that if the residual level stays for a long time, then we are in a sustained stressful situation. Even it's not in acute response, we are still on that response, and then we are still getting the negative impact on the physical health and on the mental health. Now, so we get into this kind of like a VCA cycle. What happens is that, in anxiety, we are constantly doing this, and then the easiest way would be to avoid or escape. And then in short term, because we have done that, it provides us some relief. But the long term, we get the physical symptoms, anxiety, loss of confidence. We start using some safety behaviors, and avoidance might be initially good. So, but ultimately there are situations where we have to deal with. Otherwise, it's not going to help us in long term. And ultimately, what happens is that if we continue to use avoidance, we get into a situation when it's impacting our functioning a lot. So, for example, if somebody is anxious about crossing the road, they can wait, and they can cross it when it's safe, comparatively more safe. If there is no car at all, then they are trying to go and these kind of things. However, if they become so anxious that they are deciding not to cross the road at all and not able to even go out of the house, and that spirals to this kind of anxiety problems when it becomes completely limits their functionality. And it can then generalize to other situations. So everything becomes a scary thing. So that affects, it starts from one thing and it goes to everything in their life, and they feel so anxious that they're not able to do anything and they're just sitting at home worrying about everything and being anxious. And it started with just a simple, some sort of stressful situation. And sometimes people also do some sort of safety behaviors. So the person who struggles to cross the road, they might have somebody with them. Some people will rely on medication. They might have always some sort of exit plan. And ultimately what it leads to is we are using these safety behaviors, but we are actually suppressing our emotions. So what it happens is if we suppress the emotion and we do not process it, it actually heightens our emotions because it's always there, and it actually increases the distress. And in case the safety behavior is not available, then everything falls apart. So if we always have somebody to hold our hands when you're crossing the road, and if the person is not there, we just can't even manage. We can't cross the road and nothing we can do. And then we become severely disabled. Now, how do we reverse this vicious cycle of anxiety and stress and affecting mood? Sometimes we have to confront the fears, the situation, and trying not to use too many safety behaviors. What happens is that in that case, if we do that in a measured way, then it helps us to, initially it might be quite anxiety provoking, but gradually it will help us to test out our coping skill, whether they are working. And if we find our coping skill, then we can manage our anxiety, and then we believe in ourselves that we can do that, and then we can continue doing the whole the anxiety and stress management one. Now, coming back to the how we can manage it, and in this section, I'm just going to give you the basic ideas. These things are easily available. You can do most of the things by yourself, and if you are finding it difficult to find these things, I can maybe send some sort of link or something you can look at later. But basically, again, today is more about understanding. So when we had the anxiety, we are having the physical symptoms. We are having the palpitation, the heart racing, we're having the breathing, we're having the sweating. So it makes sense to try to control them. We also have thoughts about, there's something bad may happen. We are constantly scanning. So it would be it makes sense to try to control the thoughts. And we can also change the behavior of the safety behaviors and other kind of avoidance behavior, which also leads to anxiety. So first of all, to do any of these, we first need to understand why this anxiety is happening. And everyone is different. Everyone can do things in their different way. What I will suggest that you start keeping some sort of anxiety or stress diary. It can be done in an actual piece of paper. There are kind of apps available now. There are a lot of different ways you can do it. There are websites which have got this kind of tracking diaries. You can download Paint and start doing that there. It's mainly to find out what time kind of you're getting that, what was happening, whether there was any triggers, what was the emotions going on at that time, and then try to use problem solving skills, which everyone has. We use it in different ways. We don't always sit and write down things. We do it in our head, but sometimes it's useful to actually write down the problems, thinking of the solution, pros and cons of the option, and then asking somebody if we are stuck, we can't find an actual solution. Now, also, we can take general measures of reducing stress, like, we need relaxing hobby, well-balanced diet, regular exercise, and each of them, again, has a specific reason why you are doing this, and not everything works for everyone, but ultimately, finding out what works for you. So, for example, exercise, it increases our serotonin level. Some people, when they're feeling really stressed, going out for a walk, that helps a lot. But for other person who is actually anxious about going out in a crowded places, it might not. So it depends. And constantly evaluating why we are doing something, whether it's actually worth going through the stress of something, and whether it aligns with our personal goals or career goals. That's also quite important. Some of the things, for example, if we are thinking about students doing the exam, it can be stressful, but it's part of their career goal. So it's better to try to learn to manage that, prepare that, rather than just saying that, okay, no, I'm not going to do exams. Reducing physical symptoms. This is the most easiest part. It is quite evidence-based. It's a kind of same thing for everyone. And if it's done correctly and practiced regularly, it can work wonders. There are a lot of relaxation techniques which can use. Exercise helps some people to relax. It can be quite helpful. Listening to music, reading a book, watching TV, different kind of simple relaxing ones, but sometimes we just don't do it because we are too much busy with other things and we are not actually enjoying it. We are doing too many things at a time. There are specifically focused relaxation ones where we are giving time to do relaxation. So there are lesson CDs available, there are apps, there are a lot of different music on YouTube, there are MP3s which can be downloaded. Some of the in India, it's part of kind of like Indian culture. There was a lot of different kind of things. If you think about yoga and other kind of things, it's mainly for relaxation, and some of the activities which were prescribed in a way in the past was thinking about in a kind of a structure and that kind of thing. But nowadays, because we are so busy with so many things, we forget to think about these things and forget to look after ourselves. Another useful technique is to try distracting. So what you're trying to do is, because your brain is trying to scan different things, you're asking it to focus on one particular things, and you're trying to control your attention. So you can start looking at any things in details. For example, if you are traveling in a bus and you can start looking at the cars coming on the opposite side, you can start looking at the car numbers or something, but you have to keep focusing on that. You can do simple thing like people watching. 5, 4, 3, 2, 1 is a recognized skill. It uses our senses. Again, it's like when you are in a situation, you're feeling that you're feeling too emotional, too stressed. It helps to bring us down to level. It's kind of a grounding skill. So the 5 things are 5 things we can see in our environment currently. For example, I'm in a room, I can see the computer, and there are lots of other kind of things, but it's actually noticing them, naming them, then using once we have use one sense, then we go to another sense, and then we can do, like, for example, 4 things we can hear, or 3 things we can feel. It depends. The number 1 is, the last one is about tasting, but sometimes, it's it's not always possible to taste something in front of others. So sometimes we can use something else for the number one, but ultimately it's again about being in touch with our body, using all our senses. Because what happens is that when you are stressed, when you're anxious, our mind starts to drift, and we are trying to control that. We are trying to bring it down and trying to the real life situation. Breathing retraining, it uses the breathing skills to actually control the rate of breathing. Remember, that's what happens when we are in survival situation and our breathing goes really fast. And the muscle relaxation is controlling the muscle tension. These two works really, really well, really easy to do, and it can be done anywhere. The breathing retraining, what you're trying to do is you're trying to gradually slow down your rate of breathing, and you can sometimes change your breathing style. Of course, it's based to ensure that you are in a comfortable place, and then you are trying to actually start counting your breath. You are taking, you're slowly, so you're taking one breath for, let's say, 4 seconds. Just count like 1, 2, 3, 4, and you're taking a breath, and then hold the breath, and then release the breath. And then you just keep practicing that. What happens is that if you're doing it in a situation, and then it automatically keeps your breathing, the more practice you do in a relaxed state, and also if we are in a situation where our breathing is going out of control, we can quickly do that, and it will send a signal to our brain that, okay, it's time to relax. The progressive muscle relaxation, this one I used to do a lot because I used to have a lot of kind of sleeping problems. Like all of us, what we have done, we try to work too much, try to study too much, and ultimately you end up in a situation where you are doing late night studies and things, and then it becomes a problem. And you're trying to sleep, lots of thoughts are coming to your mind, different kind of racing thoughts, and sometimes the thoughts of worry, what's going to happen this, what's going to happen that. The reason it happens is that the brain during the day was focused on other things, mainly survival and lots of other kind of things we are asking it to do. At night, it has time to process the memories. So the brain is trying to look at all the information at the same time and trying to see what's important, what's not, what information should we keep, what information should we throw out. A lot of background things happen at that time. So what we are trying to do is we are trying to let the brain do its stuff in the background, but you don't want to come to the forefront. So we are relaxing our body. And in that case, what happens is that we are trying to, what you do is you tense one part of your body and you relax one part. It depends on which part you choose and how long, if you are tensing, and how long if you are relaxing. Once you have started doing it again and again and again, you will find your own way to do. None of these are actual prescribed. It's not like as a medication that you have to take a definite dose. Everything is about what works for you, and then keep doing that. What I do most of the time is, this one says starting with right hand and then forearm. I start with my toes. That has always been easier for me. But what you're doing is you are just, let's say you are squeezing your right hand first, making a fist, and then you are trying to. Sometimes what I do is I also take deep, slow breath and imagine the breath when it's going out via that part of my body, which actually doesn't happen, but you can imagine doing that. And then slowly, after you have done it 2 or 3 times, the right hand squeezing and releasing, then you can go up to upper part, you can go up to upper arm, and you can do that. And then once that gets relaxed, you can move up to, and ultimately you can go up to your face, or if you started with hand, you can go into your foot. It depends on how and what level you are doing, and this can be done anywhere. It's not like if you do it here, we are going to fall asleep. It just helps the muscle relaxation. So remember, when you had the survival fight or flight situation, because the HP axis got activated, we have cortisol and adrenaline, all these kind of things working in our body. We have got our heart racing really fast. We have our breathing fast, and we have got our muscle tense because it wants to fight or run away. And what we are trying to do is we are trying to tell the brain that, okay, you don't have to do that. So we are controlling our breathing, or we are controlling our tensed muscle. It's difficult to control the heart, but these things, once we have done these things, then it works in the opposite way. It tells the heart that you don't need to do that fast, and then it slows down. And you can see an improvement in heart rate going down, and your digestion problem slowing down as well. Now, the thoughts. If we continue to have different kind of thoughts about anxiety, then we will continue to try to get into the fight or flight situation. So it's also quite useful to try to control or alter the thoughts. One of the thoughts are about, one of the things can be done, which is again keeping a diary. Sometimes it's helpful to reflect on the situation. So there was an anxious situation. So we can look back at it and say that, why we were anxious, what exactly happened, actually writing down the thoughts of what happened, and then again looking at what goes through our mind and being mindful about it, noticing what is happening. And then what we can do is we can try to balance these thoughts with our anxious thoughts. And most people who have got adequate resources, adequate, safe social situation, they're able to do that. Of course, there might be some people whose life in such a situation that they're not able to do that. But for most people, it is possible. This is another concept. They call it managing worry tree. It's more about, again, it's just different ways to do it. So basically noticing the worry, then thinking that what we are worrying about, then can you do something about it? But what the main thing is that it's about having some time during the day focusing on this. It's not about always doing that. So you are telling yourself that, okay, anytime a worry is coming to your mind, you're saying that, okay, I will do that in my special worry time. So it can be in the evening for 20 minutes, 15 minutes. It can be another time in the day. But if you're doing that at that time, you can focus on your current work, and you're not constantly in a state of being worried. There are other approaches. There can be behavioral experiments, some situational exposure. For example, if somebody is scared about crossing the road, they can't even go out of the house. It could be as simple as getting ready to go out, but actually not going out. We do for some patients who are really, really anxious. Second time, they'll go up to probably, 5 meters, then 10 meters. Sometimes in the beginning, they'll have somebody with them, and then after some time, they will achieve a state where they can do it by themselves. But these kind of things are sometimes done by professionals, but in a simpler level, it can be, we can do it ourselves as well. So gradually exposing ourselves to the stressful situations, thinking about how we are going to manage the stress, thinking about coping skills, maybe using some breathing and other kind of things beforehand, and then doing it later on and reflecting it and writing a diary. So everything in combination. CBT, cognitive behavioral therapy, that teaches skill to cognitive our brain, and we are trying to control the situation from the cognitive part, from the top part of the brain. Online CBTs are available, or there are lots of different kind of techniques available which are CBT based. It has got most evidence. Some people can use alcohol because initially it feels good to relax, but ultimately alcohol has long-term alcohol use of lot of mental health. Alcohol has a lot of other kind of problems, but specifically for mental health, it's a depressant. So, for example, if somebody is alcohol dependent and they have a detox, it takes about 3 to 4 months for their mood symptoms to come back to level. So alcohol automatically make people more depressed. Of course, there are pharmacological solutions. Most people will do better self-help, but some people may be so impaired that they are not able to do anything, and they may need some medication. And we use different kind of ways to diagnose. Mainly what you're looking for is how much it is impacting their functioning, and whether starting a medication is going to make things better. There are, of course, specific anxiety disorders. There are specific depressive disorders. It can be OCD. There can be phobia on certain things. There could be PTSD for some people, generalized anxiety disorder. So a psychiatrist can diagnose those things, and they can prescribe appropriate medication. Again, CBT work for some of these things. Sometimes there are other psychological interventions which work along with medication. Propranolol is one of the medication which we sometimes use to control the heart rate. It's an off-label prescription. But it can be used. Some people, they try taking inhalers because they feel that their breathing is not in control. So ultimately, rather than using inhalers, it's better to use the breathing skills to control the breathing if it's for anxiety. Of course, if somebody has asthma, they need inhalers. Sedative medications like benzodiazepines, diazepam, alprazolam, these things are okay for short term, but they're really addictive. I am an addiction psychiatrist, so I see the bad side of these things, and it just makes people so impaired, but they don't do anything. So all they can think of is just having a benzodiazepine and trying to function. But ultimately what happens, like every other addiction, they need more and more and more, and they're not able to do anything. And benzodiazepine is also very hard to come off. It's actually easier to come off alcohol or heroin rather than benzodiazepine. Benzodiazepine effects stay for about a year. What medication we use is something called SSRI. It's a selective serotonin reactive inhibitor. And the way it works is that it prevents the reuptake of serotonin. So there are more.
Excuse me, sir.
Yes,
Pardon,
sir.
sir. Yeah. So our schedule is a little bit tight today. So if we could finish within next 3-4 minutes.
Yeah, it's almost done.
Yeah. Okay. Thank you, sir.
So we are so the SSRI works this way. It's have more serotonin available so that it can control the emotions, and ultimately it helps in controlling anxiety and depression. So just to remind yourself, stress is normal. It's easy if we learn how to manage it, and we can prevent the long-term adverse effects. So looking after yourself is something we forget often. So it's quite good to actually think about whether we are actually looking after ourselves, or we are just trying to do everything else and not doing anything for us. Ultimately, we are trying to build our emotional resilience. There are some volunteer organizations. This is UK specific, so it's just I'm not sure in India. speaking to others, either a professional or other person who goes through that, that might be helpful. As I mentioned, there are apps and website you can look at for this guided medical. Thank you. Kasmi, thank you. Shall I stop the sharing?
Thank you, sir.
Welcome. Is there any question?
Dear participants, this is now. We are now in the question answer session. So if you have any question, then please unmute yourself and you can ask your question.
I have posted a question in question answer.
So go ahead if you have any questions.
Hello. So we
Hello?
have not got your question, sir. So can you repost it, sir? It might be due to internet issue that your question has not reached to us. Sir, I think one participant has told that the question has been sent it from the end, but we have not yet received. So we welcome all the questions if they have any questions from the participants. Dear participants, if you have any question, then you may post it in the chat box. It is now the question answer session. So if you have any question, any queries, then you can post it now.
Or if you want to share your experience, it's fine as well. It doesn't have to be a question. Right, okay, I can see something in here. Right.
Yes, sir. Personally, they have messaged you, sir. Extreme.
Okay, right. Yes, so this question is about having IBD, irritable bowel syndrome, and whether that is linked to stress. It can be linked to stress, but again, it depends. But stress and anxiety can make it worse. And as I gave the example, some of the hormones it can, and some of the way our fight or flight system works, it affects our from the adrenal gland. When you are releasing our cortisol hormones, it affects many parts of our body, including the digestive system. So if you're even using these simple techniques I mentioned, any of these, and try doing that and see whether that's helping. You can also try to start by keeping a diary and seeing that when your irritable bowel syndrome gets worse, it as usual, it can also be depends on some kind of food or some kind of actual stressful situation. And once you have known, unless you know the problem, it's difficult to solve it. However, you can start using some generic relaxation skills and see whether that's affecting as well. Because again, it's all of them is about knowing the problem by keeping diaries and trying to analyze the problem and then going from there.
Thank you, sir, for your answer, sir. I hope the question has been answered. And dear participants, if you have any further questions, then you can mail to us also. Otherwise, you can ask directly right now here. We are moving towards the valedictory session. So if you have any questions, then you can post it right now.